Hi, everybody. My name is Ron Chapman. I'm a federal defense attorney as well as an expert in healthcare fraud, waste, and abuse. I primarily defend clients who face federal investigations, indictments, audits, false claims act cases, and I represent those individuals frequently across the country and in many different areas, but mostly in the healthcare industry. One of the things that I want to bring to you today are the 5 most important tips for defending a federal investigation or indictment. Now, most of us don't want to be indicted. Most of us don't think we're going to be indicted. Most of us think that we are so compliant that an indictment will never reach us. And in fact, every single client that I've ever defended was surprised by the actions that the government took in response to their conduct. Why? Well, generally, people who engage in noncompliance engage in a series of decisions that sort of lead them down a path of noncompliance. And in many cases, the federal government has no problem indicting somebody for what is considered noncompliance. Make a mistake while you're coding or billing, noncompliance, the government could indict you, or they could levy a false claims case. Make a mistake with the treatment of your patient, or perhaps succumb to the wishes of patients who require opiate pain treatment. The government has no problem in moving forward and indicting you. Over the years, defending a ton of clients facing these types of issues, and especially defending them at trial, earning a significant number of acquittals across the country, I've been able to develop a pretty good sense of the things that a practice must do ahead of time in order to avoid an indictment or an investigation. Let's start with the first tip. Managing perception. Now, this is really important, okay? We all want to practice medicine and we all want to practice in our profession and do it the right way. But one thing that we don't often look at is managing the perception of our practice. This is something that I see commonly done in practices that are non-compliant. It comes from the broken windows theory. Back in the 1990s, Rudy Giuliani was the mayor of New York, and it had a significant crime issue. Well, one of the theories that he developed, I believe it was a New York police chief developed it, was that if you try to fix the broken windows, the cracked sidewalks, people will take more pride in their community, and as a result of that, there may be less crime. Now, I don't know how well that worked out in New York, but what I will tell you is that if you apply that theory in your small office, it will be effective. Are you making sure that your files are neat and orderly? Are you making sure that your staff is well trained on the phone? Are you making sure that the people in the office look presentable and this looks like a place to receive health care? This is the number one thing that practices who are in trouble get wrong. When the DEA walks in, or the FBI walks in, or any other entity walks in many cases, that practice may look sloppy. The person at the front desk may not greet them with a professional and friendly attitude. They may not be wearing a name badge or scrubs or other sort of medical attire or professional business clothing. Those little things can go a long way in managing the perceptions of your practice. If the practice looks clean and orderly to investigators, if it looks like a well-functioning practice, their mind is going to start seeing that practice as potentially a well-functioning practice. Now, you physicians, what does your office look like when you invite them back in to talk to them? And we'll talk about talking to the federal government in a moment, so just hold on before you invite anybody back there. But should they make their way back there, what does your office look like? Are your files in an orderly condition? Are the wires and the computers properly stored? You may say, hey, Ron, you're being crazy. It doesn't really matter what this office looks like. They're going to judge me based on my criminality, but that's not what my research tells me. My research tells me that first impressions are key. First impressions of everybody. The first impressions of your patients. If they feel like they're going to a clean and orderly place to receive good health care, they're going to continue that feeling even when they write that review about your practice, or if they're interviewed by anybody, the medical board, FBI, DEA, about your practice. So if you're watching this and you think that you might have some tidying up to do around the office, like you haven't dusted the cobwebs off in 5 or 10 years, I suggest you have a plan to take care of that. Now, Safe Harbor Group can certainly help you with a lot, except for the cleaning. You may need a cleaning crew for that. But when we do the front to back door inspection of the practices that we assist, we make sure that they take care of those broken windows first and foremost so that we can keep them safe. Let's go to tip number 2. This is something you're going to hear me say at every conference I speak at every podcast appearance I have: document, document, document. Now, the number one concern that I see in healthcare practices related to documentation is not that there's not enough of it. In many cases, it's that there's too much. Why would I say too much? Well, meaningful use came about in, I believe, around 2014. Practices were actually paid in order to move towards an electronic medical record format, right? Your practice may have had to transition as well. Electronic medical record companies started popping up all over the place, but those companies weren't really compliant. In fact, some of them, including Practice Fusion, have had million-dollar settlements, hundreds of millions of dollars, with the federal government because of their failures to comply with meaningful use. These became very difficult behemoths to operate. These systems were not efficient and they were difficult. The physician who used to chicken scratch on a piece of paper often had better documentation than these crazy systems. But as you know, insurance companies required more and more documentation. So what did providers do? And what did EMR companies do? They started using templates and auto-population in the medical record so that you could hit the requirements of the medical record. I will tell you, in just about every federal criminal trial I've been involved in, we have seen auto-populated records that look like false entries. And the federal prosecutor will stand up before the jury and they will say, ladies and gentlemen, this was documented, but this did not happen. Oftentimes, they will put an undercover into the practice to investigate the practice. When that undercover has a video camera on their chest, on a coffee cup, on a keychain, somewhere hidden, maybe in their glasses or a hat, they will be recording the entire visit. And if your medical records do not look consistent with what was recorded on that visit, that is a surefire way to a fraudulent charge, a charge of healthcare fraud. That's not something that we want to have happen to us or our practice. So if we have an electronic medical record system, there's 2 things that we should do. The first thing that we need to do is make sure that we're not using auto-populated entries other than carrying over parts of a history that were already completed. The second thing that we need to make sure that we do is we review our charts for accuracy and we sign them. It doesn't take that long. If we review our charts for accuracy and us physicians ensure that we sign them, we are going to be safe from allegations that we have fraudulently created charts. Now, billing is difficult. Coding is difficult. We all know that the insurance companies want to see certain entries in the charts, but the reality is, if there is auto-population of a chart, and that is the only reason that it meets the basis for an evaluation and management code of a certain type, then that could be considered fraudulent and you could be in trouble. So document, document, document. For those physicians who aren't so great with the EMR, or maybe you desire not to treat a computer and you want to actually treat a patient, one of the things that you should do as a provider is ensure that you have some sort of scribe. Now, let's not get behind on that dictation or the work of that scribe, perhaps a medical assistant that shadows you around the practice in order to complete your documentation. That's a great idea. In fact, it's one that I recommend for a lot of my clients. So when you're thinking about documentation, you need to make sure that it's accurate. You need to make sure that it's timely. You need to make sure that it's not auto-populated or in any way false. And you need to make sure that it's actually completed and it's actually signed so that you have no problems with the payers. Some very quick, easy fixes we would implement to avoid any issues. Let's go on to number 3. Number 3 is one of the hardest things for practices to understand. Investigate. When you have an employee who does something wrong, investigate. When you have a patient complaint about another patient, investigate. When you have a situation where you feel like some non-compliance has occurred because another provider or another patient has had an issue, investigate. I'm going to tell you a story. This story relates to a federal criminal case that I defended in Nashville, Tennessee, about a year and a half ago. That practice had a pretty interesting electronic medical record system that allowed the staff to send notes back and forth. And that practice was primarily a family practice, and they were primary care. A lot of the patients were receiving normal types of medications, but given that this was a rural community with a lot of working class folks who'd spent a lot of time working in the fields or working in the factories, there were people who had significant pain issues. And this physician was a compassionate physician and was caring for them. Well, because he was prescribing pain medication, there were also attempts by people who were addicted to infiltrate the practice and try to receive illicit controlled substances. So this physician had a policy where if providers or other people in the practice saw non-compliance, they would document it and then they would share it in this electronic medical record system. This is something that we would generally like to see. A note sent from one person to another saying, hey, doc, this patient has this issue. Let's make sure that we take care of it. Well, unfortunately, the notes went only one way. We only were able to see, when looking at the medical records, the complaints that were raised over the phone by family members, by other staff, to the doctor, but we never saw any investigation of those complaints, and we never saw any documentation of those complaints. This is concerning. While that provider certainly looked into those issues and talked to his patients, he wasn't very good with number 2 that we talked about, documentation. And so there was no documentation to support that the provider even cared about a patient who was potentially sharing their medication, or about an overdose that had occurred, or a patient who was admitted into the local emergency room for overuse of their medication. Those things didn't appear in the evidence as if they'd been taken care of at all. So what lessons can we glean from this physician, and how can we change our practice in order to understand the importance of investigation? Well, when anything happens in our practice that deviates from the policies and procedures that we have, we must investigate, and we must appoint somebody to do that for us. Now, some investigations can be handled internally. You can have an appointed compliance officer or investigator handle that for you. But some investigations need to be handled externally. And often at Safe Harbor Group, our experts from the DEA, from the medical board, from the insurance special investigations units are very adept at getting into a practice, investigating, and delivering a report to you, the decision maker, so that you can take firm action on the noncompliance. Investigate, investigate, investigate. Let's move on to number 4. And this is somewhat related to investigation because, as I referenced earlier, we need to have policies if we're going to investigate deviations from those policies. So, number 4 is policies and procedures. Now, I don't want you to take policies and procedures that you printed off of the internet that are related to some other practice and change the name and print them off and stick them on a shelf and say, I'm compliant, I have policies and procedures. That doesn't work so well. Ask yourself, what are my staff going to do if the DEA shows up at the door? What are my staff going to do if they receive a report from a patient that their medication was misused? What are my staff going to do when a patient complains and says, I received a bill that I should not have received, and I believe that this is fraudulent? What are the staff going to do when there's a request for medical records for a large audit? Who is notified and how is that handled? At Safe Harbor Group, we have policies and procedures that we regularly implement for our providers, but we also create custom policies and procedures that are related to the operational needs of your staff. This is the most important foundation from which you will grow as a compliant entity. Policies and procedures would be custom written for your company so that your staff can be fully trained on those policies and procedures and know exactly what to do. And your job as leadership is going to be to enforce those policies and procedures and make sure that people are taking the action necessary in response to deviations. We can create custom policies and procedures. Other entities have the ability to do that, but one thing that I will assure you is that any policy and procedure that isn't tailored to your organization is going to be used against you later to show that you knew what you were supposed to do and you didn't do the right thing. And that is a problem. I have seen policies and procedures used in a courtroom against practices routinely when they have failed to follow them. Let's get to number 5. And number 5 really should be number 1 because it's the most important, but I wanted to save it for last because I think it's the one thing that everybody misses the most. And you need those other elements before we can really start to address this. And this is staff training. Staff training is important. And here's the cycle of compliance. We have our policies and procedures. We have the ability to investigate deviations from the policies and procedures. We train the staff on how to avoid those problems or deviations. And certainly we train the staff on how to make sure that they follow the policies and procedures that we've implemented. But staff training goes a little bit further than just training on policies and procedures. Staff training means, and this is what we do at Safe Harbor Group for all of our clients, means that we ensure staff have an understanding of compliance and have the ability to help the organization move forward with compliance. When I speak at a conference and I ask everybody who has a compliance officer to raise their hand, I don't see many hands go up in the room. But then, when I ask people to keep their hands up, those that have a compliance officer, and I say, how many of you have other staff members that are trained on compliance in your practice? The hands go down. Not a single one in the room. In fact, I just did this little experiment a couple of months ago at a conference in Virginia, and there were 0 hands out of a crowd of about 100 people. No other staff trained on compliance. Here's the reality of the situation. Every staff member that you have should be trained on compliance. Every single person that works on your team should be able to say something if they see something. That is the best tip for compliance. And this is what we do at Safe Harbor Group when we train staff. We put you all in a room and we teach you about the importance of compliance. For patient safety, compliance is important. For making sure that we're billing the appropriate amount, compliance is important. For making sure that we can report a violation to a payor if we might have made a mistake, compliance is important. A lot of people think that we can run and hide from compliance issues, but that's a very dangerous game to play. Instead, if every one of your staff members is looking at compliance as part of their job and they are willing to report when they see something, you as the decision maker have the ability to take action, to investigate it, and take disciplinary action. If we start with background checks of our people to make sure that they are trustworthy and compliant people, we train them on all of the things that they need to do to be compliant in your organization, but then we also teach them how to think with a compliance mind and an operational mind. You will ensure that your staff is well-functioning, devoted to patient care. That's going to lead to happier staff, happier patients, and an understanding of how everything should function. Does this sound like a dream too good to be true? It's not. Some of the best organizations out there think with a compliant mind first. Think about the teams that send astronauts into space. Think about the military. Compliance, safety, risk management are the number one things they train in order to keep people safe in dynamic environments. Pilots are a great example. Airlines, compliance, safety, see something, say something is a common theme in these high-tension environments where personalities could sometimes get in the way of compliance. If you teach with a compliant mind first, if you teach the staff how to think first about compliance and patient safety and operations and functions, you will be on the cutting edge of compliance and you will be prosperous with your practice and with your business. But most importantly, you're going to be able to sleep at night. So I've given you these 5 tips for how to avoid investigations, indictments, but mostly tips for how to be a compliant practice. I assure you that if you establish all of these 5 things, you will be immune from indictment or government action. I'm going to say that again. If you establish these 5 things, you will be immune from indictment or government action. Why? Because if something happens in your practice, you're going to investigate it and you're going to take action. And that's exactly what the Department of Justice wants to see you do. If an employee is at fault and disciplinary action needs to be taken, you're going to have documentation of it. So when they go blow the whistle later, you will have proof of the non-compliance of the employee. This is an ironclad strategy developed from hundreds of cases that I've dealt with, from review of thousands of pages of DOJ policy, OIG policy, and other areas, and it's designed to help you become more compliant and become safe. Now, we can implement that for you, or you can implement it on your own. Feel free to contact us. Click subscribe to the channel if you're interested in having further content about this. And certainly, feel free to leave me a comment down below if you found other tips that were very effective for your practice, or if you have any questions about the tips that I've provided. Please stay tuned for more compliance advice from Safe Harbor Group, and thank you so much for watching.